For me, the highlights were some of the questions that we were asked. We've had lots of frequently asked questions into the inquiries inbox, but there were some really interesting questions today that we hadn't considered before, which included how are we going to support GPs to understand the complexity of the role that clinical pharmacists can do, and also just being able to connect with people who might be able to add value to some of the resources and products that we want to make available for practices and for clinical pharmacists. So just meeting a load of really positive people and hearing about some of the great practice that's going out there at the moment, that was really valuable for me.
And I think also, I was going to say, there was lots of questions really about how pharmacists might be supported even if they were unsuccessful in the bid. If a practice still wanted a pharmacist to work with them, which lots of them do, how can they be supported in their education and develop outside of this programme? And so I think there's a massive enthusiasm anyway to do something even if it isn't through the programme, which is good news really.
I think the nodding heads I saw in the large audience, which kind of described when we were describing the pilot and then the development programme for those individual pharmacists, was really positive. I think it's great that lots of people want to get engaged. So this will be a springboard to many initiatives, not only for this 250, 270 people. And I think, with CPPE, we will commit to try and open up access as much as possible. And I know that's what Health Edge England would want from us. I think the other part is today also we saw some good showcases of work which, the established workforce who've been in primary care for 20 years are showing how through experience, through networking, through communication, through close working with GPs, how they can make a difference, be it in prescription management, be it in working with people in their homes, working in care homes. And we can't forget that bit in this pilot. It's so easy to be dominated by the headlines, and we've got to work hard as leaders to make sure we don't do that, because people feel a little bit marginalised. And so a highlight for me and impressed on me today was that, to remember that. And intriguingly, they'll be the people who can help and guide these new people further forward, who will then become the leaders in 5-10 years' time.
Yeah. I was just really blown away by some of the stories that I heard, some of the models that were already out there of clinical pharmacists doing really challenging work at the moment. I just thought it was really powerful to hear some of that.
Yeah, I mean, I'm not one who's been doing it 20 years, but the attitude of healthcare systems changed completely over 20 years. That there used to be quite hard to get into a doctor's surgery and do some work. You always had to get permission to go in, ask permission every time you wanted to look at a prescription. But now, there's a huge demand for pharmacists to do this work, and an acceptance that this is their role, this is what they should be doing, because they've got the right skills to do it. So the only barrier now to making this successful is really the pharmacy profession itself, I'd argue, because we've got to help our juniors get educated and get into these places. But there are no other barriers, I don't think, really going on.
No, I think also you're talking to people today, I think it's very clear that the NHS England model is based on patient need, local flexibility, what models will work. And so we've got to be really careful people don't just see this 5 junior, one senior pharmacist as the only model. That was one proposal to get people thinking, but actually what works, what's working, what can we build on? So, and I think that was impressed on people today as well, that actually we need that, and that's what we look for when the bids go in as well.
Yeah, and I think the other important point that came out certainly in the workshops is that there was a recognition that this isn't just about getting pharmacists to do the jobs that doctors, GPs were doing, because we can't recruit enough GPs. It's much more about what value can we add for patients. Yeah. So we can do some of the jobs that doctors did, around prescription reviews or whatever, but we can add some value to that as well, to make life easier for patients and improve safety and quality of care for them as well.